Hello, everyone. Today I'm going to be covering HMOs, which is Health Management Organization, versus PPOs, Preferred Provider Organizations. So, when you purchase insurance through your employer, through the marketplace, you usually have options. Well, through my job, I don't have the option. I have to accept the insurance that they provide for us, and it's one option, so I have to go with that. Now, some people may have an employer that may have more options. You may have a PPO option or an HMO option. And with an HMO, which is Health Management Organization, it's basically an organization. For example, Kaiser Permanente is an organization, and within that setting, there's a group of providers that you are required to go to. They have a Kaiser hospital, a Kaiser pharmacy, a Kaiser, all Kaiser specialists and physicians. They're all in that one network, and you are required by them to go to those specialists. Now, there may be exceptions that, okay, if they don't provide this one type of service, they're willing for you to go out of their network and they will provide prior authorization. Now, prior authorization is kind of like permission. You have to get permission to be treated outside this organization you are in contract with. So, now understanding insurance is that even though you're paying with this insurance, it's a contract between you and your insurance. Not the person who's billing you, not the provider you saw. It's a contract, not your employer. It's a contract between the person you are paying. You're paying for them to provide these services or benefits through their company. So it's a contract between you and this HMO insurance, whether it's Aetna or Cigna or Kaiser. A lot of insurances have that option, either HMO or PPO. So going back to the HMO, you have to get prior authorization to be treated, or your insurance will deny. Now, it's important to know this because a lot of cards will let you know if it's an Aetna or a Blue Cross, Anthem Blue Cross Blue Shield, a United Healthcare, Coventry, or Cigna. It should let you know on the card. Sometimes it will have required PCP or primary care physician is required, and it will be placed on the card. And you're required to go to this physician. And if that physician ever left that group, you're required to stay in that network of doctors. Preferred provider organization is still it's still doctors and providers that are in a network. So your doctor has to participate with that insurance. That means they have to accept whatever that insurance pays them within that contract. They have to accept a contract with that insurance. Specifically, now a lot of places may take that insurance because they're going to bill it, but if they're not participating, if they don't have a contract with that insurance, you can end up paying more out of pocket. So now, preferred provider organization, or PPO is what I'll be referring to. They're the most common plan, I guess, where you can pretty much go to any set of specific doctors so long as they're in contract with that provider. A lot of hospitals will take any insurance. You go to an emergency room, you just hand them your emergency card, they'll take it. But do they participate with that insurance is a whole nother story. So a lot of cards will let you know to either have it with Anthem Blue Cross Blue Shield. They'll usually have a suitcase on the right corner of your card, and it will say PPO. And if it doesn't have a PPO and it just has a little suitcase, it's an HMO. Now, insurances, some insurance cards will let you know, other insurance cards won't let you know. But at the end of the day, it's up to the person who's paying for that insurance to know what kind of policy you have. So if you don't know what kind of insurance you have, you need to find that information out, because even when you're with the PPO, and you can pretty much go anywhere and get seen. Um, as long as, I mean, you can go anywhere to be treated. And so happen that your doctor participates with this insurance, they accept whatever they're willing to pay and they bill you a copay. And the second scenario is where you go to any doctor because you think it's a doctor that would be in your part of your network because you have a PPO. You can go anywhere, right? Wrong. So they're taking your insurance. They're like, yeah, we take this insurance. They don't say we participate with this insurance. Yeah, of course we take this insurance. Your insurance processes your claim, and they found out, oh, you don't have out of network benefits. So this doctor does not have a contract with this insurance. But on the flip side, you don't have out of network benefits. That means they're not going to pay the claim. Some insurances you could always appeal that. But you're more likely going to end up paying that claim that they deny. I would definitely look into your benefits packages once benefits season comes up or enrollment season comes up. Look into the different plans, the HMO versus the PPO versus deductibles versus copays. And every time you go see a physician, you want to switch up pediatricians, you want to switch up PCPs, you want to switch up your specialist. Before even booking that appointment, call them and find out, are you guys participating with my insurance? That's more specific as opposed to, do you guys take Aetna? Do you guys take Blue Cross? Of course, we take that. But they don't know your plan. They don't know, they don't have your benefits right in front of them. So they'll say, of course, because generally a lot of places will accept just about any insurance. So it's very important to know if you have an HMO or if you have a PPO. If you have in-network benefits or out-of-network benefits within that PPO, because that also covers you and lowers your out-of-pocket expenses. Well, I hope this video helped a little, and I'll be posting up more videos.